I'm Patrick Johnson. I'm a general surgery resident here at the University of Michigan.
My name is Jonathan Cunha. I'm a PGY4 here at University of Michigan in the general surgery program.
Hi, I'm Jamila Picart. I am a general surgery 4 in the Department of General Surgery. I'm on my research time.
Hi, my name is Caleb Healy. I am a plastic surgery resident here at the University of Michigan. Currently PGY4 on my first year of academic development time.
I'd say I wanted to be somewhere where I would get excellent clinical training and somewhere where I would be mentored in an effective way, a place that had a track record of residents succeeding in health policy.
I love coming to work. I love seeing my co-residents. And there were like some professional reasons why I came here as well. This is one of the few places that has a surgical education research focus.
I did feel that it was like a family-friendly environment. CHOP, the Center for Healthcare Outcomes and Policy, was another huge draw for me. So this is where I'm spending my ABT time. And then otherwise, it was kind of like a broad mix of places that I could practice. We've got the University Hospital. It's attached to a children's hospital. We rotated the Veterans Administration or the VA, and then we also have a community hospital, Chelsea Hospital, where we get to rotate as well.
So in general surgery residency, we get 2 years of academic development time. That time can be used kind of however you see fit to advance your career as a surgeon, whether that be through research goals, career goals, just ways to advance how you see yourself 10 years from now. So for me, I see myself as an academic surgical researcher who's interested in looking at the surgical workforce. And I also am very interested in understanding how we can recruit trainees to advance a workforce that is as effective as possible for treating our patients and advancing health equity.
I'll be involved in the Vascular Surgery Quality Improvement Collaborative, which is one of many quality improvement collaboratives here at U of M. So I'll be learning how to do that kind of work. And I'm also currently auditing one of the master's programs here in health policy.
I'm very interested in trauma surgery, and I'm involved in clinical outcomes research surrounding a variety of trauma topics, and I'm very happy with the mentorship and support I've had to be able to move things forward and to have some good work publications in that area. I'm also interested in health policy, as I was saying before. Some areas that are of interest to me include injury prevention, as well as access to surgical services.
Finding mentors at Michigan is super easy. They are always so welcome, happy to hear from you, happy to have a resident alongside them who's interested in what they're interested in. There's a lot of research funding at Michigan, especially in the Department of Surgery.
One thing I've really enjoyed is that of all the different areas that I've looked into, it's always been an open door and someone willing to give, talk an idea out with me and potentially be a collaborator with me.
If you have a project idea or you're interested in the type of work they're doing, they will happily have you join their team and really help you along the journey, whether that be because of your interest in research or your interest in career development or professional development. They're really there to help you along anything.
So yes, I mean, I think as a class, within our resident cohort, I think that we do all have a really good relationship with each other. I found, truthfully, that I have different things in common with each one of my co-residents, but together, we all complement each other really well. One of the things that our class was advised to do by this guy's class was to do an annual trip, which we did when we first got here, so that was helpful to kind of get to know each other and just kind of relax before getting started clinically.
The Chiefs do a really good job of just being like, Phil's Beer Garden, Thursday, 6:30 p.m., be there. And it's not in you have to come, but it's just nice to know that there's always members of our community making sure that our community is strong and together.
Even within other surgical specialties, like plastic surgery, vascular surgery, neurosurgery in some cases, orthopedic surgery. A lot of the time we'll rotate as interns with them. And so, you'll have like a point of contact with like your level person. And I think that actually kind of helps with the cohesiveness of surgeons kind of collaborating together when they're on the wards. Like, if you're going to a trauma and, you need to get neurosurgery involved, I know the two people that are in my class because I worked with them. And oftentimes you're on, multi-level teams. And so if I don't know somebody, then, maybe my chief, they know their person that they can reach out to. And so that actually really helps with when you're trying to coordinate patient care. And so I think, we have good working relationships, and that stems from having like good personal relationships,
I mean, my co-residents are my best friends. And it's not just people in my year, people above and below I see all the time, and they are kind of like, I didn't have family in Michigan when I got here. My co-residents have really taken on a major role in my support system by the bonds we've been able to form.